Hi, my name is Catherine Longo. I'm going to be doing my comprehensive physical assessment today. This is Jennifer Hall. She'll be playing my patient. First, prior to the assessment, we're going to be taking a comprehensive medical and social history. We're also going to be doing her weight, her height, and her vital signs. Throughout the entire assessment, I'm going to be assessing her mental status. By the way, she says she's well groomed, she's dressed appropriate for the weather. Her expressions are appropriate. I'll ask her a couple of questions right now to assess her mental status. Jennifer, have you felt? And then first I'm going to begin by assessing your head. I'm going to be looking at the shape to make sure it's even, the symmetry of your features, your ears. I'm going to touch your head. You're going to feel me touch your head. I'm going to check for any bumps, any depressions in your skull. I'm going to move your scalp back and forth to make sure it can be moved. Okay. Then I'm going to be looking at your neck to make sure that your neck is nice and even. There's no extra skin. Okay, and that the muscles look even on her neck. Next, I'll look at her eyes. For that, I'm going to be shining a little light in your eyes, okay? First, I'm going to shine a little light, some light in your eyes to check the reaction of your pupils, okay? If you can just look straight ahead. Check this side. Okay, very good. And if you just keep looking straight ahead, I'm going to go ahead and I'm going to look in your eyes, okay? Just keep looking right ahead and you're just going to see me looking in your eyes. Do it again, one second. Okay, and I'm going to look on your other side, okay? Okay. I'm also going to Now I'm going to just look at the color of your eyes, make sure that, can you close your eyes for me? Can you open your eyes? Just making sure that you have nothing around, no crustiness or anything exudate coming out of your eyes. I'm looking at your eyebrows to make sure that they're even, that your eyelashes are even, that you have eyelashes. And then I'm checking your irises, making sure that they're round, nice and round, and your eyelids don't cover them all the way or aren't all the way up. I'm going to be checking your ocular movement. If you can just follow my finger with your eyes and not your head. And that's also checking one of your cranial nerves, okay? So next I'm going to go ahead, I've already washed my hands. I'm going to go ahead and I'm going to touch around your face, your sinuses. And tell me if it hurts. I'm also going to check around your eye, okay? I'm just checking to make sure that there's no edema, there's no swelling, to make sure that everything is okay. Next, I'm going to go ahead and check your ears. First, I'm going to check on the outsides and make sure that there's no lesions, nothing abnormal, the skin looks normal. I'm going to look behind your ears too. I'm going to check your other side for the same thing. And your ears are nice and flexible. I'm going to go ahead and now check the inside of your ear. And check and see how it looks inside. I'm going to go ahead, since you're an adult, and pull up. It looks good. The tympanic membrane's nice and white and shiny. There's no bleeding. There's no discoloration. I'm going to check your other ear. I'm going to do the same thing on this one. The whisper voice test can also be done at this point. Mask the hearing on the untested ear by having the patient stick their finger in the auditory canal. Stand to the side of the patient about 1 to 2 feet away from the ear being tested and out of the patient's line of vision. To soften the whisper, exhale fully before whispering a random combination of 3 to 6 letters and numbers. Ask the patient to repeat what was heard. The patient should correctly repeat 50% of the sounds. Repeat with different numbers and letters with the other ear. Pediatric eye assessment. If the patient is an infant, they often close their eyes before the examination. To examine an infant, have the parent hold the infant over a shoulder and position yourself behind the parent. Turning off overhead lights can be very helpful. First, you'll inspect the infant's external eye structures for the size of the eyes. Inspect the eyes for swelling, epicanthal folds, and position. To detect epicanthal folds, look for a vertical fold of skin, nasally, that covers the lacrimal caruncle. Observe the alignment and slant of the palpebral fissures of the infant's eyes. You're also going to inspect the level of the eyelid covering the eye. To detect the sun-setting signs, rapidly lower the infant from upright to a supine position, looking for the sclera above the iris. You're going to observe the distance between the eyes, and if they are white space, inspect the sclera, conjunctiva, pupil, and iris of each eye. Also inspect and compare the corneal size. You're going to also be able to assess the red reflex, but conducting a full ophthalmoscopic examination on a newborn or young infant is often waited until they are 2 to 6 months of age unless there is a concern about an abnormality. For the exam on a young child, they are often unable to keep their eyes still and focused on distant objects. Do never hold the eyelids open forcibly. Rather, you move the scope to visualize all the retinal fields, inspect the optic disc, the fovea, and the vessels as they pass by the scope. Best response if the child is held on the parent's lap. If they are able to focus and follow commands, you can examine the child as you would an adult. To test visual acuity in children, the child has to be cooperative. If a child usually begins around the age of 3 years old. If they're at 3 years old up until 5, they use a Snellen and game or other standardized vision charts for children, such as the HOTV. Have one examiner point to the line on the chart and another assist the child with covering one eye. Have the child stand 20 feet away. Also first allow the child to practice following the instructions before administering the test. You instruct the child to point his or her arm or finger in the directions of the legs of the E, or point to the correct letter or direction of the E on a card. You should test the child with and without glasses. Examining visual acuity in younger children is done by watching their activities. Photo screening is recommended for ages 3 to 5 years of age. After the age of 5 years old, visual screening with vision charts become. To perform a pediatric ENT assessment, you often have to work quickly and have help from the parents holding the child's head. The process to examine the patient's nose and throat is the same as an adult. For a pediatric ear assessment, you're also going to inspect the auricle as well. To perform an otoscope examination on an infant, have the patient lie supine or prone so you'll be able to turn the baby's head side to side to examine each ear. You're also going to pull the auricle down to straighten the auditory canal, unlike an adult where you pull it up. For older children that will not cooperate, you can have them sit on their parent's lap sideways with one ear exposed and the other to the parent's chest while they hold one arm around the child and one arm around the head. You often have to help hold the head a little bit so you can examine the chest. I'm going to go ahead and look in your nose now. Can you first do me a favor first and just plug one nose and blow out and in? And now the other side. Okay, now I'm going to check inside your nose. Okay, if you can just look up for me. Okay. I'm gonna go ahead and look inside your mouth now, okay? You can just open your mouth for me. Check all around, make sure that it's nice and pink, nice and moist. Alright, can you stick your tongue out for me? Can you move it side to side? Can you lift up your tongue? I'm going to go ahead and use the tongue depressor. Okay, I'm going to stick it in your mouth, and then I just need you to stick out your tongue. I'm going to look at your tonsils and just say ah.
Ah.
And then I checked your gag reflex as well. I'm sorry.
It's okay.
Can you just smile for me? Can you puff out your cheeks? Can you raise your eyebrows? Okay. Can you smile? Can you frown? Okay. And I was just testing your cranial nerves as well, okay? And I looked at your teeth while I was looking in your mouth, and everything looks good. I'm just gonna check the movement of your neck. Can you just touch your head to your shoulder, your head to your shoulder? Can you look to the right and to the left for me? Can you look up and down? Okay. Can you shrug your shoulders for me? Okay. Okay, Jennifer, now I'm gonna go ahead and feel for some lymph nodes, okay? Just let me know if anything is sore or tender or hurts when I touch it. Did anything hurt?
No.
No? Alright. Now I'm going to test a couple of your cranial nerves again, okay? I'm going to use my little device. I'm going to go ahead. You're going to feel a vibration on your head. You let me know if you only feel it on one side or you feel it on both sides, okay?
Both sides.
And now I'm also going to test another of your cranial nerves. And you're going to feel the vibrations again. First, I'm going to put it behind your ear. You tell me when you don't feel it anymore. And then I'm going to put it in front of your ear. You tell me when you don't hear it anymore, okay?
Okay. Okay.
And now I'm going to do the same thing on the other side. I'm going to check your vision. Normally we would normally have a Snellen chart, and I would have her cover each eye and have her read the lowest letters that she can read, but we weren't able to get one of those. So pretend that we already did it. So now I'm going to do something called the Romberg test, and I'm going to check for your nearsightedness. You can just hold this up to your eye and cover one of your eyes and read the smallest line you can.
LTFH.
Okay, now do the same thing with the other side.
LTLFH.
Very good. I'm gonna come behind you now. I'm gonna just feel your thyroid, okay? And then your trachea. Does it hurt or any tenderness?
No.
I'm just gonna feel your trachea now, okay? Can you swallow? Alright, very good. Alright, so I'm also gonna check some more of your facial nerves, some of your cranial nerves. I just need you to close your eyes, and I'm gonna touch something to your face, and you tell me whether it's hard or soft.
Okay.
You ready?
Okay. Hard. Soft. Hard. Hard.
I should have not thought of how it's supposed to be sharper. Okay.
I can't tell the difference because the
Yeah,
you're
right.
patty, and I'm just like,
Yeah, you'll like
okay.
Okay, ready? Okay. So now I'm going to test another one of your cranial nerves, okay? You're just going to tell me whether you feel it soft or something sharp. I'm going to have you close your eyes, okay?
Okay.
Here we go.
Sharp. Soft. Sharp. Soft.
Okay, very good. All right. So next I'm going to go ahead and do your respiratory system, okay? I'm just gonna first by starting out. Normally we would have them undressed done as far as they can, but since it's for the appropriateness of this video, we're gonna have her wear a gown. So I'm gonna inspect your chest. I'm gonna look for your amount you're breathing, the diameter of your chest to make sure both sides are symmetrical, that your ribs are symmetrical. Then I'm going to go ahead and touch your chest. I'm going to be looking for any lumps or anything, okay? Just making it on your sides, okay? And I'm going to do the same thing on the back. So I'm just gonna check your diameter of your rib cage. If you can just breathe in and out. Okay. And if you can just say Mickey Mouse for me.
Mickey Mouse.
Can you say it again?
Mickey Mouse.
And then again.
Mickey Mouse.
And then another time.
Mickey Mouse.
Okay. Then I'm gonna check your hands for your cup refills. Very good. I'm going to go ahead and listen to your chest and see if I hear anything abnormal, okay?
Okay.
I'm going to listen to you to the front, and then I'm going to listen to the back. Can you take a deep breath for me? And then again. Sorry. And then again. And then again. I'm going to listen to your back now, okay? Can you take a deep breath? And then again. And then again. And then again. While I'm here, I'm going to go ahead and listen to your heart too, okay? And the 5 points. And it's going to be right under here, okay? You're going to feel me now. I'm going to be tapping on your back, okay? Just let me know if it hurts. So now I'm going to go ahead and look again at her neck and see if she has any jugular distension. I'm going to check all her pulses, including her brachial. And her radial. I'm going to check the ones on her feet. Check the ones behind her knees. I'm going to check her legs for any edema and her feet for any edema. They're nice and warm. She doesn't have any varicose veins. No edema. And also, if this is a real exam, I would also be checking her femoral veins. But for the point of this video, that we will be checking her femoral pulses right now. Okay, whatever. So now I'm going to have you lie back. Put this up for you. Alright. I'm going to be checking your abdomen right now. You can just lift up the gown. Okay, I'm gonna be looking again, of course, if this is an exam, I would be looking at the color of her skin on her abdomen, if there is any bruising, any scars. Now I'm gonna go ahead and listen, okay, Jennifer? I'm also gonna look right now too if she has any pulsating in her upper abdomen, which could be her aorta pulsating. Next, I'm going to percuss her abdomen. You're just gonna feel me tapping on your stomach, okay? Let me know if it hurts. No pain?
No.
Again, I'm gonna palpate your stomach. I'm gonna go ahead and feel it and see if I feel any lumps or anything. Feel anything that's abnormal. Let me know if it hurts at all, okay? I'm gonna first softly and then I'll do it a little harder. Any pain?
No.
Now I'm gonna do a little harder, okay? Just checking your liver and your internal organs and your kidneys and everything, okay? Alright, I'm done. You can put your gown down. Thank you. Okay, Jennifer, now I'm just gonna be testing your range of motion, okay? You just relax and let me move your arms. Okay? Okay. Now I'm gonna be doing your legs now. Just relax and bend them. Just gonna try touching your ankles. And now your wrists. And then your fingers. Okay. So now I'm gonna just have you sit up. I'm gonna go ahead and push this in. And you go ahead. You got it?
Yeah.
Okay. I'm gonna have you stand up. Now I'm just going to be testing your feet. If you could just walk back and forth for me. I'm also looking at the symmetry of her muscles and her skeletal system. I'm going to check your alignment of your back. If you can go ahead and turn around and then just bend down. I'm going to check. Okay, very good. I was also checking for the alignment of your shoulders too, okay? I'm going to be checking some of your balance and coordination, Jen. If you can just get your finger, if you can touch your nose and then touch my finger, as fast as you can. Alright, very good. Can you just touch all your fingers like this, as fast as you can? Okay. And then if I can just have you walk, balance, we're going to check your balance, okay? You can just stand up, close your eyes and lift one foot. And now, on the other side. Alright, thank you. A comprehensive breast exam should be performed on both men and women during a comprehensive assessment. Women's breasts can vary in shape from convex to pendulous, and often one breast can be slightly smaller than the other. Men's breasts should be generally even with the chest wall unless they are overweight, in which then they can be a convex shape. The skin texture should be smooth with no dimpling and contour uninterrupted. Venous networks can be visible but should be symmetric and are only pronounced in pregnant or obese women. The areola of the breast can range from pink to black, and the nipples can be inverted or extroverted. If they are recently inverted nipples, it should ask if when it happened or if they had always been like that. Nipples should be the same in color and match the areola. Upon palpation of the breast, examine female genitalia. Upon inspection, the pubic hair should be smooth, clean, and free of nits or lice. The labia majora may be gaping or closed and may appear dry or moist. Usually they are symmetric and may be shriveled or full. The tissue should feel homogeneous, soft, and free of any lesions, swelling, tenderness, or signs of trauma. The patient's labia minora may appear symmetric or asymmetric, and the inner surface should be dark pink and moist. Upon palpation, its tissue should be soft, homogeneous, and be without tenderness, lesions, or nodules. The clitoris should be 2 centimeters or less in length and half a centimeter in diameter. There should be no adhesions, inflammation, or atrophy. The urethral opening should appear as an irregular opening. There should be no discharge, polyps, caruncles, or fistulas. There should be no signs of irritation, inflammation, or dilation. Vaginal introitus can appear to be a thin, large orifice with irregular edges or a thin slit. Perineal surface should be smooth. It should be non-tender, no inflammation, lesions, growths, or fistulas. The anal surface is darkly pigmented and the skin may seem coarse. With an internal examination using a speculum, the cervix color should be evenly distributed and pink. It should be midline and in a horizontal position. The cervix should not protrude more than 3 centimeters into the vagina, and the surface should be smooth. Nabothian cysts may be present. Any drainage should be odorless, be thick, stringy, or thin, creamy or clear, and may be heavier mid-cycle or right before menstruation. In nulliparous women, their os should be small and round or oval. In multiparous women, it is a horizontal slit or may be irregular or stellate. Upon palpation, the vaginal wall shall feel smooth, homogeneous, and non-tender, and free of cysts, nodules, masses, or growth. The size, length, and shape of the cervix upon palpation should correspond with the inspection during the speculum exam. It should move easily 1 to 2 centimeters each direction without any pain. The patient's uterus should be midline, pear-shaped, 5.5 centimeters to 8 centimeters long, but may be larger in any direction in multiparous women. The contour should be rounded with a firm, smooth walls in non-pregnant women. The uterus should be able to be moved with no tenderness. If the patient's ovaries are able to be palpated, they should feel firm, smooth, ovoid, and be 3 by 2 by 1 centimeter in size. If they are healthy, they will be slightly to moderately tender upon palpation. Examine male genitalia. Pubic hair should be coarser than scalp hair. It should be in the pubic region and may continue midline to the umbilicus in abundance. The penis should not have hair, but the scrotum may have a small amount. The dorsal vein on the penis should be visible. If a patient is not circumcised, the foreskin should be able to be easily retracted, and a small amount of smegma may be seen over the glans. If a patient is circumcised, the glans is exposed and appears erythematous and dry with no smegma present. The orifice of the urethral meatus should appear slit-like and be located on the ventral surface, millimeters from the tip of the glans. The opening of the orifice should be glistening and pink with no discharge. The penile shaft should be non-tender on palpation with no indurations. No discharge should be able to be elicited. The patient's scrotum should be deeply pigmented than the body skin with a coarse surface. The scrotal skin should only be reddened in red-haired men, but is not normal in other patients. The scrotum may look asymmetric with the left testicle lower than the other. The thickness of the skin of the scrotum varies upon age and temperature. Upon palpation, the patient's testes should be sensitive when gentle compression is used, but should not be tender. The testes should feel smooth, rubbery, and free of any nodules. The epididymis should be smooth, larger, cephalad, discrete, and non-tender. When the patient's inner thigh is stroked, the testicle and scrotum on that side should rise.